She is Sonali. When Sonali was 1 month of age, her mother suspected that she is not responding to even very loud sound. She brought Sonali to the audiologist for her hearing testing. Hearing tests like brainstem auditory response and autoacoustic emission, along with other behavioral tests, showed that Sonali was having severe sensory neural hearing loss in both ears. She was not able to hear other speech, and as a consequence, it was affecting her speech and language development. The audiologist recommended to go for binaural digital hearing aids. The audiologist programmed the hearing aid according to her hearing loss. She was fit with binaural hearing aids at the age of 6 months and enrolled in auditory training and speech therapy. Today, she is 3 years old and is regularly monitored by her audiologist by adjusting the gain in the hearing aid. Because of early detection of hearing loss, on-time fitting of hearing aid and regular speech therapy, she can understand other speech and has developed near-normal speech and language skills. And in the future, she will not have to depend on sign language for communication with others. But in some children like Ankita, hearing aid might not give sufficient benefits. So, cochlear implant is recommended. Cochlear implant is a surgical procedure where the auditory nerve is directly stimulated through electrodes, and sound is understood by the brain. Audiologists take care of intraoperative and post-operative programming by deciding how much current is allowed to pass for each electrode in the inner ear. After the cochlear implant surgery and regular programming of the device, along with auditory training, Ankita is now able to hear and understand others and is also acquiring speech and language skills rapidly. 58-year-old Navnath is complaining that he cannot hear other speech. Other persons have to talk loudly, and every time he has to cup his ears to understand speech. Hearing evaluations like pure tone audiometry and emittance done by the audiologist showed that he is having irreversible sensory neural hearing loss in both ears because of normal aging process. Hearing aids was the best choice for him. The audiologist programmed the hearing aids according to his hearing loss and other related factors. After wearing the hearing aid, he can understand speech on the phone, when spoken from behind, and most importantly, his brother need not talk loudly to him. Thus, audiologists are registered and most qualified professionals for assessing the hearing status in pediatrics, adults, and geriatrics. Audiologists provide intervention through hearing aid, cochlear implants, and auditory training for permanent hearing loss cases. They even help prevent hearing loss by providing hearing protection devices for people working in factories with a lot of loud sounds. They have a role in assessment and management of balance-related disorders. Audiologists also recommend assistive listening devices for hearing impaired individuals. They refer their clients to other professionals whenever required. Thus, audiologists help the clients to cope up with their hearing loss and communicate effectively with others and enjoy life at its fullest.